Welcome. We're going to begin a look at the lymphatic system today, and we'll begin by looking at kind of an overview and then into the different organs that are involved in the system itself. So when it comes to lymphatics, we talked a little bit about this back when we talked about the cardiovascular system and vessels and the heart itself. When we talked about it in terms of the lymphatic vessels side of it. And so this is a portion of the system where we have these kind of uh, lymphatic vessels following along all of our uh, capillary beds, all of our blood vessels themselves. We have both superficial and deep vessels within the system itself. And we talked about it then as being kind of picking up what the vascular system left behind. And so kind of getting everything out that was no longer needed in the system itself or out into the extra space that's there, and allowing for us to kind of pick up all that was left over. The other side of it is that we've got various lymphoid tissues and organs kind of strewn throughout the whole body. And so we have them in different areas, and we'll talk about those in terms of their function and where we find them as well. The main job of our lymphatic vessels is to get all of that interstitial fluid back, all of that extra fluid that was left behind from the capillary beds, and pull them back into the blood vessels. And so we're going to get them eventually back into the blood, but first they're going to have to go through the lymphatic system that's there. As they do so, that interstitial fluid itself is going to potentially mount an immune response. And so we're going to kind of clean it, look at it, make sure that the things that are inside there are able to go back into the bloodstream before we put it back in there. In other places, we're going to do things like transport lipids. And so coming from the digestive tract, we have special lymphatics that are going to help us move the lipids from the digestive tract into the blood as well. That is there. That fluid that we're pulling back in from the interstitial fluid, once it's inside the vessels, we call it lymph. And so lymph becomes the term for this kind of milky fluid that is floating through the vessels of the lymph that we have. And so lymphatic vessels are found everywhere. And this is just kind of a small showing of all of the vessels that we have. But we have them in and around the entire body. There are two different major drains for the lymphatic system that we'll talk about. The right lymphatic duct draining only this green region of the body there. And then our thoracic duct, which basically drains everything else. We have special areas where we have lymph nodes in different parts of the body. Those are going to be basically where we kind of have lymph vessels coming back towards the core of the body, coming back towards the main portion of the body, or with direct connections to the outside world. And so places like the digestive tract, the respiratory tract, our arms, our legs, our head, all have kind of the potential for things to get in from outside of the body, and we want to make sure that we can stop that before it gets too far in. At the deepest level, or at the smallest level of the lymphatic vessels themselves, we have our lymphatic capillaries. And so those lymphatic capillaries are similar to that of the blood capillaries in terms of their size and their shape and kind of even how they form inside. But the main difference is that when we look at the end of them, we see that they are blind-ended. They just kind of begin. And so they're not open on the end. They do have little valves that are there that are going to allow for the fluid to come into them, but they're not connected to anything else. Their connection, in a sense, is only going back towards the venous system, getting back towards that thoracic duct or the right lymphatic duct, not having a circular or a circuit type of a connection at all. They just kind of begin there. So it is a one-way system rather than a circuit in terms of the blood vessels themselves. And so our main goal here is to get that lymph back into the venous side of the circulatory system and eventually, in a sense, back towards the heart. And so it's always constantly moving from wherever those capillary beds are towards the venous side of things as they begin. We start out with very, very, very tiny capillaries. And so we have these microscopic, just like the capillaries themselves, blind-ended. So the vessel itself, in a sense, just begins. And then it goes out and others join into it, and so on, and they have their ending as well. And so in those ends, they're going to have little valves that allow fluid to come into them, but not go back out once it's actually in there. Those smaller microscopic capillaries then get into larger vessels, and so we have these collecting vessels that are there, and then eventually the vessels lead into trunks, the trunks lead into the ducts, and then the ducts back into our venous system. So the capillaries themselves begin with all of the blood capillaries, and so our lymphatic capillaries are beginning in the same place with the blood capillaries, and they're similar to them in terms of their kind of leakiness or their permeability to them, except that they're a little bit more permeable than that of the capillaries. They also have small little mini valves that allow for kind of pressure exerted from the outside to push the fluid into the vessels, but at the same time they're not going to collapse those vessels at all either within there, and that's going to help to move the fluid into the vessels and along them as well. Once that fluid kind of comes into the vessel that is there, I'm going to show a picture here. So as our fluid comes in through these little mini valves, that allows for that fluid to enter in, but it can't come back out. So it bumps up into it and it gets essentially turned away, so to speak. And that's going to maintain that integrity of that vessel. The fluid can come into it. The vessels themselves can withstand all the pressure of that interstitial fluid that's there, and they're not going to collapse down either. That's also not going to push the fluid back out of them at the same time. To help to hold them into their place, we do have these little filaments here. So we have some collagen connective tissue fibers that are there, and that's going to help to hold them into place next to blood vessels, next to other tissue, depending upon where they are. And that'll maintain their position within the tissues as well. A little bit closer up view of essentially the end of a lymphatic capillary as well. And so here, surrounded by all kinds of tissue that's there in and around them, and the fluid is starting to come in between all that tissue. As it does so, it makes its way into the inside of the capillary end, and the flow is going to be moving on out. Since that flow is does not have a pump, it's really low pressure. So there's not a whole lot of pressure that's in there. Just simply even squeezing the tissue from the outside, kind of even just rubbing your hand against your skin, things like that, helps to move lymph along within the vessels themselves. Raising a limb, we've experienced having like a sprained ankle, something like that, where it has swollen, and as we raise it up, it then drains more of that fluid away, and it becomes smaller in terms of the overall tissue size that's there. And that's partially because of those one-way valves. Again, we can get the fluid in, but it's not going to be able to move back out whatsoever. Once we have all that fluid inside the capillaries, it's going to flow along until it gets to lymph nodes. And as it flows along within the lymph vessels and gets to a lymph node, this is where we're going to now inspect the tissue, the lymph itself, for any kind of concerning substances. So other things can get in through these capillaries. They are very, very permeable. So things like cellular debris, so back to our sprained ankle kind of a thing, if we've got damaged tissue from those ligaments, cells are there, the connective tissue is torn, things like that, that can potentially get absorbed there, proteins, etc. Any kind of pathogens, so viruses, bacteria, parasites, whatever it happens to be, can find their way into the lymphatics as well. And then cancer cells, tumor cells, things that have left the primary tumor itself, can end up inside there as well. So we want to catch those things before they have a chance to kind of move on. And that's where the lymph nodes come into play. So the lymph nodes are essentially there to capture, destroy, before they allow for things to move on. And so they're going to cleanse and examine this debris. They're going to look for, is there a pathogen there? Is there a tumor cell inside there? Is there things that we need to break down in terms of proteins and things like that? And that's where those lymph nodes are going to come to play. And if needed, if we have things like pathogens, we're going to mount an immune response at the same time. So those are kind of our general lymph nodes all throughout the body. We do have some specialized ones called lacteals. These lacteals are special capillaries that are found in the digestive tract. And so they're inside the intestinal mucosa. And they're utilized to deliver fats, lipids, from the digestive tract into the bloodstream. And so most lipids have to be transferred via lymphatics rather than going directly into the blood itself. So these collecting vessels arise from our small capillaries. They are similar very much to that of veins. So they do have the same 3 tunics as that of veins. And so we have our tunica intima, our tunica media, and our tunica externa on them. Just like veins, they have very thin walls. They've got a relatively large lumen compared to their vessel size. It's the majority of it is the lumen itself. They have quite a bit of anastomoses, and so they're branching all kinds of branches off of them and coming into them as they come in. And these, the fluid that's inside there is coming down from kind of more superficial areas. And so they're going to be draining the skin, they're going to be draining kind of the superficial areas and getting those vessels to move down deeper to travel along next to the arteries. When they get down towards the arteries, now, in a sense, the vessels have a pump. They're now being pushed down by those arteries all the time, and that's going to help with that pumping of the lymph through the vessels themselves because they're kind of getting squeezed as they move along. Those larger vessels are also, just like veins and arteries, going to contain their own blood supply. So they're going to have their own vasovasorum as well. Here we have just a picture of the valve that we find in these vessels. So the normal flow of lymph is in this direction. And so once it goes through that valve, any kind of fluid that then wants to try and push back can't get back through, in a sense, that little hole. It comes down along the side of the valve itself, and so it gets blocked, and it doesn't have that ability to flow backwards. It can only, in a sense, turn around and go back in the normal direction. Those collecting vessels move into our lymphatic trunks. The lymphatic trunks are basically getting us back into the core of the body for the most part. And so these lymphatic trunks are now where the collecting ducts are moving into larger areas, like in the lumbar region. And so bringing lymphatic fluid up from the legs, bronchomediastinal for the lungs and the heart region, so basically the thoracic area. Subclavian coming down from the arms and legs. I'm sorry, the arms and the neck, primarily the arms there, and then the jugular trunks bringing blood or lymph down from the head as well. The digestive tract has its own trunk, and so it has its intestinal trunk that is then going to help to drain into our larger ducts from there. So as they keep on coming into the trunks themselves and move into the ducts, this is where we have that split in terms of how much each of them actually covers. And so the right lymphatic duct only drains the right arm, the right side of the head, and the right side of the thorax. And so that's the only part that it actually drains. The thoracic duct then drains the left arm, the left thorax, the left side of the head, and everything basically below the diaphragm. And so the thoracic duct gets the whole lower part of the body. Everything that is below the diaphragm is drained through these lymphatic, the thoracic duct, and we leave the rest then just to that right lymphatic duct. So here we have the big, long thoracic duct as it makes its way up. Let me change the color here. It begins by the combination of our lumbar trunks coming into the cisterna chyli here, as well as the intestinal trunk. And that then blends together and gives us our thoracic duct. It's receiving fluid coming from the left side, and then coming down from the left jugular and the left subclavian, all to join into that thoracic duct there. The right side is receiving fluid coming up from the chest on the right side, coming down from the right jugular, the right subclavian, and then the right bronchomediastinal. And that is it. So the right side has tremendously less fluid drainage than that of the right side. As I mentioned before, the lymphatic system has no pump, and so it lacks a pump. So just like the veins, it's going to need to rely upon basically anything and everything it can to kind of squeeze the fluid through it. And so this is everything from, as I mentioned, nearby arteries. So as they're running next to an artery, that movement or that expansion of the artery onto the vessel will cause fluid to move through. We have things like smooth muscle, skeletal muscle, to help with moving the fluid through them as well. And so the smooth muscle is found within the actual lymphatic walls themselves. The skeletal muscle is just simply just like that of the veins. As our skeletal muscles contract, they help to pump that fluid through the body itself. And then again, our respiratory pump also helps with that process. And so does gravity. But gravity doesn't really work like a pump per se. It just helps to simply pull that fluid down through it. The tissue that we find within the lymph is that extracellular fluid, but we've also got some specialized cells running through the lymph as well, especially in the lymph nodes. And so we have lymphocytes. So remember back to our blood, we had lymphocytes, and those lymphocytes came in two varieties. We had either T cells or B cells. And so their location of their maturation and their function tells us what they do as far as those T cells and B cells are concerned. Those T cells and B cells are going to be the primary actors against any kind of perceived threat from pathogens or tumor cells, things like that, that are inside the lymph as it is being cleansed. If those vessels should happen to become blocked in any way, we're going to end up with lymphedema. And so lymphedema is essentially just kind of swelling, but it's from the lymph itself. And so it's a back of or a decreased ability to drain the lymph from a particular area of the body. And so this can be quite great in terms of the amount of swelling that is there. And here we have a few examples. And so the upper right picture here, we have an example of post-mastectomy lymphedema. And so the right arm there is almost twice the size of the left arm due to the swelling that is there, and that causes the limb to start to swell there. Over here we have, due to a infection, we have lymphiasis that's there, and so this is going to cause a single limb to become very, very swollen if not taken care of. And so here we have to simply get rid of the parasitic infection, and that will then go away. And so elephantiasis there is what we get for the outcome. Any of these situations may require something like a gauntlet in terms of an arm, or support stockings as far as a leg goes, something to help to squeeze that fluid out. Here we have a mechanical pump, and so basically air chambers alternatingly squeeze and pump the fluid out of the arm. We can also see the effect of the lymph on the superficial. On this one here, we have a bruise, and that bruise has caused the skin to start to become discolored there. And by using something that is going to reduce the amount of pressure on the surface of the skin, a special kind of tape there, elastic tape, that then you can see where in certain areas we have lightened the amount of the bruise. And so kind of a checkered pattern was used there, and the bruise has gone away, and that's actually after only 24 hours of application. Here we can see in somebody who has quite a bit of lymphedema as well. We have high areas, and then we have low areas, peaks and valleys in a sense. Those areas where the tape was, that reduced the swelling and caused the fluid essentially to disappear from those particular areas. So lymphedema can cause quite a bit of disability as well in those limbs. It's going to cause quite a bit of backup there. So we want to make sure that that flow is going the way that it normally should, and that when we get to the lymph nodes, we have the ability to defend against anything that may possibly be there. And that's where things like our T cells and our B cells come into play. And so T cells and B cells are going to attack anything that may happen to be coming through the lymph itself, whether that be a bacteria, whether that be a virus, or whether that be a tumor cell, would be the kind of more common ones. The possibility of a blood transfusion, and so if we have a transfusion reaction, that can be taken care of there as well. And so anything that we perceive as being foreign, that's where our T cells and B cells are going to start to come into play, along with some other cells as well. And so T cells, remember back to the white blood cells, these ones actually go out and actively attack and destroy any kind of foreign cell that is an antigen. And so anything that we see as being foreign, it is going to destroy. Whereas the B cells don't really actively destroy things on their own, they generate antibodies. And so they're going to create antibodies by producing plasma cells. And so those plasma cells will then produce all the antibodies. The antibodies can then grab onto the antigens, present those antigens over to our T cells, to macrophages, to be able to destroy those particular offenders that we may have in the body itself. Lymphoid tissue that we have in the body kind of implies that it's not quite lymphatic tissue. This is going to be found in kind of different areas within the body. If you remember way back to tissues themselves, one of the types of connective tissue that we had was reticular fibers that was there, and this created our ability to trap things within it. And this is going to be found in kind of different areas within the body itself. And so we have actual lymph nodes or nodules, and those lymph nodes or nodules are going to be attached to our lymphatic vessels that are there. But we also have kind of lymphoid tissue that is what we call diffuse lymphatic tissue. So this can be things like MALT, mucosa-associated lymphatic tissue. And basically just we have this kind of reticular tissue that's there that forms things like our tonsils and things inside our digestive tract to be able to catch things before they get too far into the system that's there. The lymph nodes themselves, we have essentially an expansion of the lymph vessel, and it forms these little nodes. And inside these little nodes, we have a bunch of that reticular connective tissue as well. And inside there, we also have a large amount of lymphocytes and cells that are going to help to destroy anything that gets caught inside there. Those lymph nodes, as we mentioned at the very beginning, are found in places of the body where we kind of attach a part of the body back to the main core of the body. And so we have our inguinal nodes, our axillary nodes, our cervical nodes. We have those of the intestinal tract as well. And we have those of the bronchomediastinum as well for the lungs. The job of those lymph nodes is filtration. Hopefully we're not coming across anything that is potentially harmful, but it is going to hopefully destroy any microorganisms that it finds. This is why partially when you have a cold or something like that, your cervical lymph nodes may become swollen. They may become tender because they're actively destroying things inside them. They're getting rid of those infected cells that are kind of coming through the body at that point. And that's where they activate the immune system. And so when we find antigens that are there, those are going to then start to activate our immune response, and we're going to go out and actively destroy anything that shouldn't be there, any of those infected cells or the viruses themselves, and get rid of them, or the bacteria, whatever it happens to be. When we look at a lymph node, we'll notice that the lymph node has kind of a bean shape to it. Almost looks like a kidney bean in terms of its appearance that's there. It is surrounded by a capsule, and then within that capsule we have trabeculae. Trabeculae are, in a sense, just kind of the pathways through the lymph node. And so these are kind of like the channels, in a sense, that they create within them. And within those channels, we then have distinct regions where we can find different things going on as well. And so it's divided up into a cortex and a medulla. And so we have the outer cortex, and then we have the inner medulla for each of those regions. In each of those places, we have slightly different types of cells that are in those areas doing slightly different things to the substances that are potentially there, that we're finding there. So the cortex itself has follicles, and then it has germinal centers. Within those germinal centers, we have B cells, and those B cells are, especially if they are finding antigens, those are actively dividing. They're dividing and dividing and dividing, creating more and more plasma cells to get us more and more antibodies. We have dendritic cells. Those surround the follicles themselves. Those are around each of the follicles that we have there, and those are, again, looking for substances that shouldn't be within the blood itself. We have T cells that kind of move in towards the deeper part of the cortex that is there. And the T cells themselves are going to kind of move in and out of the lymph as well as the blood. And so these are going to move back and forth, in a sense, mounting an attack and sending out signals and mounting an attack and so on. And so they can kind of actively move in and out between either one. Once we get deeper into the medulla, we still have our T cells and our B cells here as well. So they're not just strictly set out there for the into the cortex, but they are into the medulla also once they're there. This is where we're then going to have more kind of pathways to go through and make their way in through the lymph node itself as well. We've got, now that we've seen, in a sense, our T cells destroying cells, we've got our antibodies grabbing onto antigens as well and making those antigen-antibody complexes. We've got to be able to get rid of a lot of these proteins. And so we've got to be able to break them down, and this is where the macrophages come into play to start to destroy things that are inside that lymph node. One of the other things that you'll notice here when we look at an actual lymph node is that the incoming fluid has more vessels entering into the lymph node than we have exiting. And so just like with arteries and veins and nerves, things that are going towards the system, in a sense, are our afferents, and our efferents are going away. And so afferent vessels we have many more of, and efferent vessels we have very few of, which means that the fluid, as it's coming through the lymph node, slows down. Its movement through that lymph node is going to become slowed, and that allows all of those T cells, B cells, dendritic cells, macrophages to really kind of inspect and destroy anything and everything that is there. So we have a number of afferents. We have relatively few efferent vessels. And so we have less of the efferents than we have of the afferents. And so that lymph that's going through there is said to kind of meander. It kind of wanders around, makes its way slowly through the vessel or through the node until it eventually gets to that efferent vessel. And so we have fewer efferent vessels that is there, slowing down that fluid flow through it, and gives all of those T cells, B cells, dendritic cells, plasma cells, antibodies, macrophages, plenty of time to potentially destroy anything that is not meant to be there. So that when it comes out the efferent side, we've essentially got cleaned lymph as it exits that particular lymph node itself. We don't want things moving on. But the good thing is that right next to it, essentially, we're going to have another lymph node. And then after that one, we're going to have another lymph node. And so on and so on. So as we move into those chains, our inguinal, our axillary, cervical nodes, all of them are a chain of nodes that go back to back to back, so that even if we were to miss something that came through, we can potentially catch it in the lymph node, next lymph node. And so we can do all the same process once again into that next lymph node, and then if not that one, the next one, so that by the time it gets to the venous system, it's completely clean and we haven't let anything by that shouldn't have. And then next up, we'll start to talk about the lymphoid organs in the next video and see what we have there as well.